Hey everyone, welcome back for our 7th online lesson. We are going to start a section today on responsible substance use. Now, this is a pretty lengthy topic, so we're certainly not going to get through it all in this first lesson. I also know that this is not your first time hearing about this subject here at Wake Forest, certainly, but there's a reason for redundancy when we talk about responsible substance use. My goal with this lesson is certainly not to tell you what to do or to have a moral conversation, but to do what we call harm reduction, right? So if you are someone who chooses to use substances, how do we reduce our harm? In this first lesson, we're going to mostly talk about addiction and what it is and the addiction process. And then as we move into next lesson, we'll talk more about some specific substances like marijuana, tobacco, and alcohol. First, let's look at why we even talk about this topic. Let me read through this slide with some statistics that maybe you've heard and maybe you haven't. Almost 21 million Americans have at least one addiction, yet only 10% of them receive treatment. Drug overdose deaths have more than tripled since 1990. From 1999 to 2017, more than 700,000 Americans died from overdosing on a drug. Alcohol and drug addiction cost the U.S. economy over $600 billion every year. More than 90% of people who have an addiction started to drink alcohol or use drugs before they were 18 years old. Americans between the ages of 18 and 25 are the most likely to use addictive drugs. Obviously, this is a very relevant topic in your age group, so we need to really think about this and think about our relationship with substances if, again, that's something we choose to do. So let's start with kind of the question of what is addiction? You may have a preconceived notion of what it is, so let me give you a couple different ideas of what addiction is. So first of all, it's an involvement with a substance or activity despite negative consequences. So it's not always substance related, even though typically that's what we think of, but certainly can be an addiction to an activity or a behavior. Addiction is classified as a true mental illness. There's a dependence. You have to have it to feel normal, physiologically, psychologically. The person no longer uses the substance just for pleasure. So maybe when someone first tries a substance, they really like the high they get. They really like the way it makes them feel. But over time, they simply use that substance or activity to just get through the day, just to maintain a normal, because without it, there's really uncomfortable feelings that we call withdrawal. Another way of looking at this is addiction as a compulsive and chronic pattern of using a substance or type of behavior for soothing, comforting, or as a way of evading uncomfortable feelings. This definition really gets to the root of addiction. It's often a coping mechanism, right? We're often trying to cover something else up that's uncomfortable or that we don't like. This definition comes from a former Surgeon General, and it says addiction is a chronic disease of the brain. It's one we have to treat the way we would any other chronic illness, with skill, with compassion, and with urgency. So this definition is really trying to break the stigma of addiction, right? Addiction is not a moral failing. It doesn't make someone a bad person. Nobody sets out to be an addict. Right? It doesn't discriminate based on socioeconomic class or race or, anybody can be addicted. Nobody sets out with that intention. So we need to break the stigma and we need to think about this like a chronic disease and treat it, again, just like we would any other chronic disease. So when we talk about addiction, there's 4 characteristics that are always present in an addiction. So I'm going to go through each of these quickly here. So first is a compulsion to use. Let me use alcohol as my example because it's a pretty easy one to use in college students. So compulsion. Let's say that, you're back on campus next semester and you're invited to a party, and the very first thought in your mind when you're invited to that party is, will there be alcohol? Like it has to be there for you even to want to attend, right? There's a compulsion for that activity. There's a loss of control. So maybe you go to that party and you think, okay, I'm just going to drink one drink. That's it. But you end up drinking 2, 3, 4, 5. You can't control your behavior at that point. There's negative consequences. So maybe that's relational, maybe that's financial, maybe that's physical, maybe it's social, but there's some negative consequence, but you can't abstain from the behavior because the craving is so strong, right? Even if you wanted to go to that party and not drink alcohol, you wouldn't be able to because there's such a strong craving. So let's think about what are the most common sources of substance disorder in our country. So think in your mind, what do you think it might be? I'll give you a couple seconds just to think about what do you think it is. If you said nicotine as number 1, you are correct. Number 2 is alcohol. Number 3 is actually marijuana. And certainly some people make the argument that marijuana is not actually addictive, but next lesson, we'll take a closer look at marijuana and actually why it is an addictive substance. Followed by painkillers, cocaine, heroin, benzodiazepines. So I already mentioned this, but not all behaviors are not all addiction are substance related. Some are addiction to behavior. That's what we call a process addiction. Okay, so a process addiction is an addictive behavior. These behaviors can actually release dopamine, just like a substance, make you feel pleasure, and make you want to do them over and over again. They can be mood altering. So what are some common addictive behaviors? Things like exercise, shopping, gambling, technology. And these things aren't necessarily bad. Think about exercise, right? Exercise is a good thing, but you can become addicted. Technology is a good thing. It's allowing us to keep continuing with classes right now, right? But technology can become an addiction. Here's the big picture of addiction. We as humans will seek to find pleasure and, for the most part, avoid pain at all costs. So we have to think about, what are we using to find that pleasure? What are we using to cover up that pain? Maybe it's a substance, maybe it's an activity, but maybe it's a pattern of thought, or maybe it's a feeling, or maybe it's a person, some kind of codependence. So while we're going to really focus in on substance addiction in this lesson, we want to understand that the addiction process is actually much, much bigger than that, and can be many, many different things. So when we're talking about substance addiction, there are 4 things that we typically call risk factors. So why might one person be at a higher risk of addiction than somebody else? The 4 things are tolerance, a family history, the age of onset of the behavior, and mental illness. So let's start with tolerance. So what is tolerance? We use this word a lot. Sometimes people even like to brag about their tolerance. What does that even mean? So tolerance is actually developed when a progressively larger dose is needed to produce the desired effect. So prime example, maybe when someone starts drinking alcohol, after 1 or 2 drinks, they like that, right? They have reduced inhibitions, maybe they're more social, they like that feeling. But over time, maybe it starts to take 4, 5, 6 drinks to feel that same effect. So they've developed what we call a tolerance. And when you do your Healthy Choices project, you'll look a little bit closer about tolerance, and you'll learn that a functional tolerance actually doesn't affect the way that your body processes alcohol. So even when you have that behavioral tolerance, you're not feeling the effects, your blood alcohol concentration is actually still rising at the same rate.
This is a very complex genetic issue, and it's not
actually
like there is
genetics,
an addiction
family history.
gene in the story.
So it's really
probably
important
like
to
there's
know your
50
family
or
history of
100
addiction,
genes
because children
that
of
can
addicted
give you
parents
vulnerability
are at
under
the
a variety
risk.
of different settings
So
or
take some
issues.
time,
So
find
as you think
out,
about
have
it, some of
family
the
members,
things that have been
siblings,
looked at genetically,
grandparents,
there may
cousins, aunts,
be a
uncles,
genetic
have they had
vulnerability to
alcohol or other
starting
drug
drug use.
problems?
There may be
We
genetics
also know
for
from some
how
new
much
current
does it
research
activate
that
your reward
babies who are
system when you
born
take
addicted
it.
to drugs
So it's the difference between,
actually
well,
are
I
at a
use cocaine
higher
and
vulnerability
yeah, well,
later
it
in
kept
life
me
of
up, but other
themselves
than that, it
becoming
was a real
addicted because
drag
there's
to,
some
wow,
permanent
that
brain
was great.
changes that happen.
That's probably
This
genetics.
is a really complex issue.
Continuing drug
one
use, why
gene,
would you
it's the
continue
interaction
to
of
use it
many
even though
genes.
you
If you
appreciate it
go
could
to the
have some
PowerPoint
serious
version
negative
of this
consequences?
lesson, there
That's
is a sound
probably
clip
some of that's coming
that you
from
can
genetics.
listen to that talks a little
The
bit more about
addiction
this, and it's
process
pretty
itself, this
interesting, so I
may have to
encourage
do
you
with
to go on and
frontal
listen to that.
cortex and decision making. Some people are very good at decision making. Even when they were teenagers, they seem to make the right decisions. I've seen 2 or 3 of those people. They're in the Smithsonian now, but I've seen them. So, becoming addicted, the difference between what the prefrontal cortex is doing or can doing, may be a genetic thing.
So the third risk factor is the age that you started using a substance. And this graph right here shows alcohol use. And you can see that those who started using alcohol at a younger age, so 14 or younger, were much more likely to either abuse alcohol or to become dependent on it than those who waited until they were older, specifically those who waited till they were 21 or older. This trend is very similar to most other drugs. Marijuana has a very similar trend. But the takeaway is that the younger that you start using a substance, the more likely you are to abuse it or become dependent on it. The last risk factor is mental illness or the presence of other mental illness. So we do classify addiction as its own mental illness, but often there's a dual diagnosis between substance abuse and something like anxiety or depression or bipolar disorder. And what we can really boil this down to is this concept of self-medication, right? So maybe somebody has anxiety, right? So you have anxiety and, oh, I drink a few glasses of wine and it's like magic. It goes away. You know, you feel great. Well, what happens to that anxiety? That anxiety comes back, and maybe the anxiety comes back worse. So you end up trying to cope over and over with the alcohol and needing more and more and more of the alcohol, which leads to a tolerance, which leads to a dependence, which certainly leads to addiction. These are some numbers, some pretty interesting recent numbers from 2018. You can see in the green are those who have a substance use disorder, and in the light blue, you have those with a mental illness. In the middle, you see the number of the population that there's a crossover. So 9.2 million over the age of 18 have both a substance use disorder and a mental illness. Addiction is something that certainly affects friends and family in a big way, right? So we talked about in the very first class that we don't live our life in a bubble. Our behaviors affect other people. This is a great example. We usually break this down into 2 categories of codependence or enabling. So codependence is when somebody else's life is controlled by an addict, their behavior. So think about a prime example being like the spouse of an addict or a child of an addict who constantly has to walk on eggshells, constantly has to cover up for that person. There's no boundaries. They live in this chaotic, crisis-oriented mode. That is classic codependence. What we see more of in college is what we call enabling. So enabling, by definition, is someone who knowingly or unknowingly protects an addict from the consequences of their behavior. So here's a prime example. Let's say that you have a friend who loves to go out and party on the weekends, on Wednesday, and you're always that friend who's like, hey, you do what you want to do. Don't even worry about it. I'll make sure you get home safely. Right? Sound familiar? That kind of attitude that I got you every time, that safety net, may actually be enabling behavior. They may not really ever understand the consequence of that behavior. Now, please listen closely. If you have a friend who needs to get home safely, please take them home safely, right? I'm not telling you to let someone feel the consequences of their action, but I think we need to be careful the way we interact with each other because it's very, very easy to become an enabler. So let's switch gears just a little bit and talk about what is a drug. Okay, so this is, again, what we're going to focus on in terms of addiction. So how do we define a drug? Drugs are substances other than food that are intended to affect the structure or function of the mind or body through chemical action. Lots of words. What does that mean? What is a drug? A drug could be something like caffeine. It could be nicotine. It could be a prescription pill. It could be an over-the-counter pill. It could be alcohol. But again, anything that affects the structure or function of the mind or body through a chemical action. So let's talk about how drugs affect the brain. So the first thing we have to understand is that any time that our brain feels pleasure, it releases dopamine. Okay? Dopamine increases in response to natural rewards, things like food, things like art, things like exercise, even things like sex. The problem with drugs of abuse is that they release so much more dopamine than we can ever feel in natural life. So you get this rush of pleasure. Okay, that's why we call it a high, because it's so much higher than we can feel in natural life. You can never feel that pleasure in natural life. Well, what's the problem? The problem is your brain creates that as the benchmark of pleasure. So you're constantly chasing that over and over and over again. And that's why drugs are so addictive. Now, someone who's recovering from addiction will tell you one of the most difficult things to do is actually learn to feel pleasure again in natural life without the drug, because the pleasure sensation has been so distorted. The brain now thinks that pleasure is what happens with that drug, and it's really difficult to feel pleasure without that. How quickly we feel that pleasure certainly depends on how a drug is administered. And there's 4 most common ways drugs are administered. You have oral ingestion, you have inhalation, injection, and transdermal. So which of these do you think gets to the brain the fastest? If you said inhalation, you are correct. That's the fastest route of administration, certainly followed by injection. The most common is oral ingestion. We've all taken a pill by mouth, I'm sure. And the most dangerous is injection. Anytime you break the skin, you're putting yourself at risk of infection. Now, why do I even talk about this? It's important because you need to take a drug the way that it's prescribed. So if you're prescribed a pill to be taken by mouth, that's how you need to take it. Drugs are legalized based on 2 things. They're legalized based on their dosage and also how they're administered. So change one or the other of those, even if it's prescribed to you, and you actually change the legality of the drug. Now, not all drugs should be taken together, right? So sometimes drugs interact, and there's many different ways they interact. They can compound the effects of each other. They can reduce the effects of one or the other. They can eliminate effects altogether. So it's important to know how drugs interact, specifically if you are someone who chooses to drink alcohol. Alcohol is one drug that really doesn't play nice with most other things. So let's give some examples. Let's say that you are drinking alcohol and then you decide to introduce another depressant into your system. Let's just say Xanax, right? Another powerful depressant. What's going to happen to that depressant effect? It's going to be really, really strong. It's going to be really compounded. That can lead to unconsciousness, respiratory depression, potentially worst case scenario, even death, right? You're going to have a really compounded effect. Now, let's say that in another situation, you have a stimulant in your system. Let's just say you're drinking a Red Bull or some other kind of energy drink. Like you've got this stimulant in your system, and then you decide to drink alcohol. What's going to happen to the effects of that alcohol, that depressant? Are you going to feel it? No, you have a stimulant in your system that's going to mask the signs of intoxication. So you might drink more and more and more because you're not feeling the effects of that depressant, right? You're masking, you're reducing the signs of that depressant. So again, it's really important to think about what you're interacting, but specifically if you choose to drink alcohol. So there's 2 terms to know, and we often use them interchangeably, but they're actually 2 different things. So drug misuse and drug abuse. So drug misuse is very simply using a drug for a purpose it's not intended. Drug abuse is excessive use of a drug. So often we use these when we're talking about illicit drugs, illegal drugs, but they can certainly apply to over-the-counter things as well, certainly legal things. So let me give you some examples. Benadryl. So what is Benadryl supposed to be used for? Allergies, right? It's an antihistamine. Sometimes people use it for sleep. So by definition, that is misuse of a drug or using a drug for a purpose it's not intended. It wasn't marketed for sleep. It wasn't tested for sleep. So that's drug misuse. How about drug abuse, excessive use? Think about over-the-counter painkillers, ibuprofen, Tylenol. Man, I have a headache and the bottle says to take 2, but I'm just going to take 3 or 4 instead. By definition, that is abuse of a drug. Right? That is more than is intended. There's lots of different types of drugs, and we're not going to talk about all of these just for the sake of time, but I do want to spend a little bit of time in this lesson talking about prescription drugs. Okay, so prescription drugs are things that you have to get from a physician, and it's prescribed for your certain condition. You should only take a prescription drug when it is prescribed to you. We have seen a pretty big increase in prescription drugs over the past decade or so, and there's one class of drugs that is really wreaking havoc on our society. If opioid painkillers came to your head, you are correct. So we've seen a pretty big increase in opioid painkillers that really spiked in about 2010. Okay, so the peak was in 2010, and we've since seen the number of prescriptions decline. And actually in 2018, we were at a 15-year low in opioid prescriptions. So this chart here shows all drug overdose death rates from 1999 until 2018. And you can see that in 2018, we actually had a dip in drug deaths for the first time since the 1990s. But the point I want to make here is that the driving factor behind these drug overdose recently has been opioids. Okay, about 2/3 of all drug deaths are opioids. And what's driving that? That's often synthetic opioids, things like fentanyl, tramadol, fentanyl analogs, and then also heroin. You can see heroin is that green line. So there's been a steady increase in heroin and a very, very big spike in those synthetic opioids. So I jumped from talking about prescription drugs all the way to heroin and fentanyl. So what's the connection between those two? Things like opioid painkillers, morphine, hydrocodone, Percocet, Vicodin. What's the connection between that and heroin? I heard a doctor say one time, and it was so interesting to me, that they're essentially the same thing. One just comes in a pill bottle and one comes in a little plastic bag. Well, what happens to that pill bottle? They can be hard to obtain, they can become expensive, so addicts often turn to heroin. 4 out of 5 heroin users actually started with a prescription opioid. The problem with heroin, you can't control the purity. So if it's laced with fentanyl, that's a really common cause of fatal overdose. This opioid epidemic really is a public health crisis, and it's something that goes way beyond the individual. We've had a 300% increase in the number of babies born addicted to opioids between 2000 and 2009. We're also seeing a huge increase in the number of children in foster care, 147% between 2000 and 2017, simply due to parental drug use. Okay, so this is one of those things that doesn't just affect the individual, it affects many, many, many other people. There's a lot of things being done in response to the opioid epidemic. I want to talk about just one, and that's access to the drug naloxone. You may have heard of naloxone. It's also called Narcan. Essentially, it's an opioid antagonist. So it's the antidote to an opioid overdose. So what happens when someone overdoses on an opioid is that their central nervous system and the respiratory center is depressed. So this drug actually unbinds the opioid receptors and allows them to breathe again. So what this map is showing, and don't get too caught up in the colors, is that in every state, residents can purchase Narcan or naloxone nasal spray directly from a pharmacist. Okay, so there's open access to naloxone. Now, the nasal spray that's purchased may not be strong enough for something like a fentanyl overdose, but all first responders also carry an injection that is a bit more potent. Now, these laws certainly are not without controversy. The controversy is that many people think this is enabling, that we're just allowing people to overdose without any consequences. But it certainly is a life-saving drug. So just one thing being done in response to the opioid epidemic. Let's switch gears just for a minute and talk about prescription drug trends among college students. It looks a little bit different than the general population. So we may certainly see pockets of students who abuse painkillers, Vicodin, OxyContin, codeine, Percocet. We may see pockets of students who abuse benzodiazepines. That's things like Xanax, Valium, Ativan. These are very, very powerful depressants. And something to keep in mind is they are the most often prescribed to treat anxiety or panic disorder, but they're also extremely addictive. Okay, and they're very incredibly physically addictive. Benzodiazepines are one of two classes of drugs that the withdrawal can actually kill you because there's such a physical addiction. And if you're not aware, the other is actually alcohol. So what we see most commonly abused among college students are prescription stimulants, things like Adderall, Ritalin. We often call these study drugs, drugs that are used to kind of get ahead for academic gain. Often it's seen as no big deal to abuse stimulants because, hey, it's prescribed to someone else, but I'll just take it too. Well, here's the thing. We think that people with ADHD, who it's actually prescribed for, have naturally lower dopamine levels. So these stimulants allow the dopamine to come up to a place where they can be productive, where they can focus. But in someone who uses it non-medically, it almost kicks you into like an overdrive, right? So you feel like you have to have it to be productive. 67% of people who abuse stimulants are current or former college students. So a very, very common population of people to abuse stimulants. Now, for someone who's taking this non-medically, there are certainly short-term effects like impulsive behavior, paranoia, irritability, insomnia, some mental health problems that weren't there previously. A few drug companies have actually started putting suicide warnings on their labels because it can cause a lot of psychological effects. For those who use it non-medically, there's a very high potential for abuse and dependence. A lot of research, and this is pretty interesting, points to the fact that stimulant drug abusers actually tend to have lower GPAs. So while we often use this for academic gain, to get ahead, it seems like that's not actually happening. I very briefly mentioned this before when we talked about drug interactions, but stimulants and alcohol, again, are not something you want to combine because stimulants have the ability to mask certain indicators of intoxication. So someone might, continue to drink and drink more and more and more because they're not feeling the signs of the depressant. There's a really interesting documentary on Netflix called Take Your Pills, all about prescription stimulants. If you have some extra time and you want to watch it, I highly encourage it. It's pretty interesting. It talks a lot about the history and gives some personal testimonials of people who have used stimulants. So I encourage you to watch that. So the last time we did the National College Health Assessment in the fall of 2017, we asked students about prescription drug use. Have you used someone else's prescription drug in the last 12 months? You can see that almost 11% of them said they had used either one or more of someone else's prescription drugs, and the vast majority of those, 8%, were prescription stimulants. All right, we're going to stop there for this lesson. We'll pick this up in our next lesson. What I'd like you to do is to write down a couple of things that you learned, things that were new concepts to you that you hadn't previously learned, and upload those to Canvas. All right, talk to you all soon.